Hello, everyone. Welcome to the Wolfpack Wellness Research web series. I am your host, Dr. Susie Goodell. This series is a collaboration between the University Wellness Advisory Committee, the NC State Libraries, and NC State Wellness and Recreation. And we aim to discuss the wellness research happening across campus. And for those of you who are joining us live via Zoom, you can submit your questions to our speaker in the chat function. We'll have a Q&A time at the end of the show. So as you can see, today's guest is Dr. Tracy Ryder. Dr. Ryder is assistant professor of agriculture in the College of Design. No, not assistant.
Architecture, not agriculture.
Oh my gosh. And the word says architecture right there. My brain is
fine.
Sorry.
It's fine.
I'm College of Agriculture, so maybe that's my brain. She's assistant professor of architecture in the College of Design. She is an interdisciplinary research leaders fellow with the Robert Wood Johnson Foundation, working to advance health and equity towards Robert Wood Johnson Foundation's culture of health. Her research focuses on how the built environment of a hybrid elementary school community center in an underserved community can increase positive health outcomes for students, staff, parents, and the larger community, framing the built environment as a health intervention. So thank you, Dr. Ryder, for joining me.
Sure.
I use this term, the built environment, several times when I was discussing your research. Can you first, before we get into deep, define what the built environment is?
Right. Yeah, sure. So, when you talk about environmental sustainability, or you're talking about like the natural world, right? So what we're trying to do is make a distinction between what is designed and built by our professions, right? So design, architecture, landscape architecture, and that the environment, the natural environment that just kind of exists. And so instead of saying just architecture, my research often goes beyond the scope of the building, right? The actual building. And so we look at a lot of planning strategies or landscape design strategies, which are all kind of in our world of the built environment, things that have been designed and built purposefully.
So can you tell us a little bit more about your research lab, you as a person in the world?
Sure. So my background is has historically been in sustainability and the application of sustainability strategy. Sustainability is kind of a poor term because what we do isn't actually sustainable yet, right? It's more green. It's more less bad than it is actually sustainable. When you're talking about current practice in architecture or the design professions. So my background is really in green strategies to enhance efficiencies or health or environmental efficiencies, energy efficiencies, water efficiencies, like resource efficiency in the built environment. So at the building design, landscape design, planning scale, right? That has, in the last years, become very focused on energy and energy efficiency, or human health and well-being. And my master's degree was focused more on occupants and how people use the space and the impact our built environment, the interior spaces, the exterior spaces, all have on the users of the environment. So I have kind of shifted into looking at the health impact of our built environment on people that inhabit it, whether it's the people that inhabit it directly, like me in the space right now, or people that, kind of pass through it or walk by it or don't intentionally inhabit spaces like some of our urban spaces. So that's what I'm interested in looking at.
So can you tell me a little bit more about this project within the school's community center piece?
Yeah, so it is a project that we came up with based on a variety of other research that we'd done before, and Aaron Hipp is on the call, I see. So he is my co-PI and my partner in crime in the public health world. And so this project was built on work that Aaron and I previously did with Robert Wood Johnson, where we were looking at how multifamily developers kind of thought about, implemented, or strategized around the concept of health. And we were really looking at, to me, my perspective of that, and he might have a different one, but my perspective of that study was about the different ways that we talk about health, the way that public health folks like Aaron talk about health, the way that me and my folks in design talk about health, and then the people that the multifamily developers, like the developer and the real estate folks, talk about health. And we all kind of talk about health in different ways. We might be talking about using the same terms and talking about different things, or we might be talking about the same things and using different terms, or vice versa. And it was very convoluted. But we were really interested in how that built environment, at the time it was multifamily housing, how that built environment could not just impact negatively, but could support health outcomes for the residents at the time. And then there was we came across this purpose-built community in Florida that we visited for that study. And a purpose-built community is a very intentional, larger scale kind of quarterback organization for developing or helping to develop and support under-resourced communities, kind of at this very large scale. And the folks in Florida were like, there's one in Raleigh. And so we connected with Kia Baker, who was at the time heading up Southeast Raleigh Promise, which is the purpose-built community for Raleigh. And we came across this opportunity. The school was just being built, and it was it was a joint roof with the YMCA. And so we said, well, this is just getting going. Like, we applied for this funding before the school was open. And so we thought we had a really good opportunity to look at, with Wake County and the way that we're situated, that we could potentially track some of the students that were at another school before, and then look at how they performed over the course of a few years in this new school and see if there were differences, right? And compare it to other schools and say, well, what does the absentee rate look like in this school versus other schools? What does, the nurse visits look like? What do the vacation days for the staff look like? What does all of that look like? And kind of compare it, and then look at how that building not only impacts the students that are in the school every day and the teachers that are and the staff that's in the school every day, but how does the design of that facility and the programs that facility can support, because of the way that it's designed, right? Because it has things like a community kitchen, which we don't usually have in K-12, a swimming pool, also not things we have in K-12. So how does that facility and the way that it was designed and the programs that it supports because of the way that it was designed impact the health of the students, the staff, maybe the parents of the students as kind of an iteration out, and then even larger, the community that may not go to the school or the facility every day, but how do those health impacts and supportive elements kind of ripple out into the community?
So based on this design, the built design environment kind of thing, correct me if I'm wrong, but you didn't have control over that design. It was already being built, about to open.
Yes.
And so what kinds of, you've kind of discussed some of the pieces of what health looks like in terms of absentees, visits to the nurse's office and things like that. But what other kinds of health parameters are y'all looking at?
Yeah, so that's a great question, because some of the things that we're trying to look at are, well, we're trying to look at quantitative data like that, right? And what kind of quantitative is there? What kind of quantitative data is there that's reliable with the little people, the little population that we have, right? And then it opened in fall of 2019. So then they were in school for maybe 4 or 5 months, and then they left. They weren't there for a number of years, right? So for at least a year. So we're looking at all of those factors, but we're also trying to figure out what are metrics for emotional health that we can measure from like the little people, right? Even if we were going to give surveys to the kids, getting them to give you any kind of good data is very hard. So we've been talking with teachers. We had teachers fill out a survey, and we did some interviews with teachers, working on the assumption that the teachers know their students and they know their families, particularly in schools that are very well connected to their community, right? And so we're trying to do some quantitative and qualitative data that way. We are still sending out surveys now. We just sent one out earlier this week as a revisit of the same survey, because the first time we did the survey was spring of 2021, and they had only been back in the school for like a couple of months. And so we got some ideas about how the building was functioning and how the site and how the design of the site and the community was kind of functioning around that building. But now that they've been back for a year or a year and a half, we're asking the same questions over again, right? So we're looking for those kinds of quantitative and qualitative answers. We're also doing, Aaron and some of his students are doing observations on site and looking at how people use the track or the amphitheater or the play spaces or things like that. And what does that look like in terms of who's using it, how are they using it, when are they using it, and how does it connect to things like the Greenway, because it's right by one of our greenways. And we're still trying to figure out what emotional and wellness looks like in the context of a school, and how do we start to measure those things for the different levels of population.
So I have so many different questions. I actually had the privilege of visiting this space before COVID as well. So I kind of have a vision of what you're talking about. And I know that one of the things is it's a school and it's also a community center, and they have after school programming there, right? So are you looking at outcomes like education outcomes such as grades, or are you looking at social interactions and all that kind of stuff too?
So ideally, our plan was to look at outcomes like grades. But once they're out of school for COVID for a year and a half, your testing is all skewed. Like, we're not going to get good testing grades for a while, probably, like reliable testing grades. So that was our plan, but that did not work. So what we did when we were trying to course correct for COVID or during COVID is we identified another school that is about as close of a match as you can get. Mm-hmm. So it's serving the same community. It's under the same public school system. So it's got the same policies, right? It's got the same hiring policies. It's got the same community with the same needs. It was also designed by the same architect. So the school systems, all of the different school systems around have, a number of architects that they use to design their different schools. So you could have any given number of designers or actual professional firms designing whatever school, but we found one that is actually designed by the same. So there's not like a big difference in, aesthetic preferences or design strategies that would be inherent to the design firm. And so we thought that was a pretty good match, right? It's in the same community, it's serving the same community, it's the same umbrella, and it's the same design firm. And so we sent them those teachers and staff the questions as well. And so what we're doing is we're looking at a comparison of a self-perception of, how do you feel about the spaces? How do you feel about how the spaces support your mental and emotional wellness? How do you feel about how the spaces support your physical wellness, right? And so that's how we're using kind of that comparison. Since we don't have some of those metrics in terms of test scores or attendance, or because attendance is crazy even now, right? If you test positive, you're out for at least 10 days. If you don't test positive, you still need to stay home, right? There's a whole bunch of things, and attendance is not consistent anymore. So there's all in health, right? Nurse visits, they're at the nurse visits all the time. So it's going to take us a while, I think, to normalize what those previously standard metrics were and figure out what they look like now.
So based on the data that you've sent out, or the instruments you've sent out and the data you've received so far, have you got, even if it's just anecdotal, what you're seeing, have you got some information on what the impact, hopefully positive impact, has been? Yeah,
we've presented it, our initial findings at a few conferences and written a few papers on it. And there is a notable difference between the two schools and how the faculty and staff feel that their emotional, social and emotional wellness is supported by the one case school versus the other school. It's pretty dramatic. Like when you see the pie charts, right? It's like blue is not good, green is good. And one is like green, like it's notable difference. So we're digging more into that with this second round of surveys.
So I don't know if you've gotten into any of the qualitative data, but as a qualitative researcher myself, I'm always interested in the why and the how. So when you're talking about the fact that these teachers and administrators at the case school are feeling more supported, do you have any indication of why that is, or how that's being not perceived, but how the support is actually happening?
Yeah. So I'm a qualitative researcher as well. Erin is my quantitative counterpart. And we did kind of have a debate about what do we do first? Do we do the surveys first to help us figure out what we're going to ask in the focus groups, or do the focus groups to figure out what we're going to in the focus interviews to figure out what we're going to ask in the surveys? And so we did the surveys first, and then we asked the questions, right? Because we say, okay, well, there is a difference. So what is that difference about? Why do you feel more supported here? Because since it was a new school, most of the teachers were also coming from a different location in the county, right? Mm-hmm. So they weren't new to teaching. This wasn't their first exposure to a school building, right? They had something to kind of compare it to. And so they could say, well, there are a lot of different types of spaces. So there are some quiet spaces, there are some connected spaces, there are spaces where we can be, where we can move furniture around and we don't have to sit in seats anymore, in rows anymore, or even in K-12 classrooms now are much more maneuverable than they used to be, right? So the seats roll around or whatever. But even beyond that, right, there are spaces where there may be some different types of seating and the kids can really work in groups and move around. So they're very excited about the different types of spaces, because in some of the higher risk communities that we have, not just this school, but other, high risk populations, they have a bunch of, there are different ways that the students or the kids might deal with it. Lots of different types of coping business, right? Some kids might want to be in a smaller, confined, quiet space to help kind of bring them down if they're having a moment. Some might want to be near nature. Some might want to be in a cafeteria where there's like tons of people and tons of activity. And so to have all of these different spaces and spaces that you can retreat to, and not just for the kids, but when the teachers need a minute to take a breath, they have different places that they can go. They are also talked about the not just the level of connection to the community, because the spaces, the facility was designed obviously with the community center, the Y there with it, but also things like there's a front porch on the media center, right? So there's rocking chairs and there's places that are more amenable to just taking a second, like that are designed for you to sit and kind of marinate or meditate, or there's even a meditation circle actually on this site. So there are places to do that. They enjoy that ability. But in addition to being connected to the larger community, they feel a sense of connection in the building itself. The width of the hallways, the glass and the glazing, the side lights between the doors into the hallways, so you can tell that people are, even if you're in your room by yourself teaching during COVID, you still know that there's people out there. There are people walking by, right? There's an interaction between the spaces. In this one, there's a kind of an overlook between some of the maker spaces and some of the community spaces down into the media center. So there are connections, not just between the spaces on the same level, but in different levels. And a number of the teachers mentioned having the ability to take walks at lunch or on their free time, their free period, whether that be going out and walking around the track or going to the meditation circle, but they could also walk across the hall and go walk the track at the Y, right? When it was cold or raining or whatever. And then they started to meet people in the community. So there were a bunch of different, I would say intentional design strategies. From the early planning stages to even this is how we're going to do this building, right? These are some of the strategies that we're going to put in the building.
So now that you have the beginning steps of the data, what are to collect data that you already have, but are there other things that you're looking to do to expand the research, to expand the type of information you're gathering? Are you going, I assume maybe you'll do some cohort data where you follow them over longitudinal periods?
Well, we'd like to do cohort data, but we haven't really started with that because, again, we started with COVID. And I think the year or two coming out of COVID, especially for the little people that are trying to figure out how to be in a space, right? I think it's very challenging. It might have been different if it was a high school where they might have remembered how to be with people, right? It's a thing. So I do think that we want to continue to follow up with this school, and that's what we're doing with the survey that we're doing now. We are also thinking about how to broaden these considerations to other building types or other scales, right? So One of the opportunities that we have that we haven't been able to capitalize on quite yet is the affordable housing development that's right across the parking lot from this facility, right? And so that is another opportunity to see how the residents of that apartment complex capitalize on, don't use the facility. So what does being in close proximity to a facility like this mean for residents outside of the school, right? And so there is probably an opportunity to find a fairly well matched housing development somewhere else that doesn't have that, right? So we have that. We've also talked about looking at other YMCAs and what does that do for them, right? Being co-located with a school. And we've talked to YMCA of the Triangle about things like that. There's a lot of opportunity there. We've talked about translating some of these things that we're learning and some of these design strategies into other spaces focused in that community. So one might be for teens. We've talked with some of our partners about looking at the development of those types of spaces. Kia Baker specifically, who is one of our partners. So it's Aaron, Kia, and I, we're all tied together equally in this research. And Kia has since left Southeast Raleigh Promise to do other consulting in the realm of kind of development, community engagement, community support, equity, and things like that. And so we've been talking with her about what kind of support from our end does she need for those types of things. There are also other things that I'm interested in. There are a handful of other projects like this around the country, right? There's, one in Austin, there's one in Minneapolis, there's one in Louisville. And so looking at those communities and seeing how the support that those facilities provide compared to the support that ours, like, is it a thing? Are there common qualities among them? Are they all providing similar elements of support and similar thresholds and similar effectiveness, whatever effectiveness is that we define effectiveness as, right? And if so, then what does that mean in terms of, design strategies or policies for how school systems develop? I'm also interested in looking at how these types of facilities help support communities in terms of resilience when weather events roll through, right? So it's not just about keeping the lights on so the kids can go to school, but what happens in the week or the 2 weeks or the month or 2 months after when the community is trying to get back on its feet after something? What kind of support, design support, social support, programming support could facilities like this really provide in terms of like a community resilience or a social resilience? So there's a whole bunch of things that we can begin to look at from this.
There is, for sure. So I want to put it out there for anybody who is here live. Please put your questions in the chat box and I'll start taking those, but I'm going to keep asking questions until something pops in the chat box. So we often talk about or assume that these intervention types are going to be positive impacts, but as you mentioned early on the word negative. Have you seen any things that were counter to what you expected, or maybe there's some negative impacts that you even anticipated that you're seeing?
I don't know that there's anything within our scope or within our questions of anything that we've seen as negative. I think we came in assuming that this particular facility is kind of a level up, right, for what this community has seen, just by virtue of the fact that it's a new, bright and shiny building, for one, right, and it's partnered with a community engaged entity. So I think we were just kind of, what we wanted to see was, how is it, right? How is it doing it? What kind of measurements can we show to, quote unquote, prove or right, that these types of things work, and these types of things have more than just increased test scores, but they also have community impact. So that's what we're looking for. But again, we hit a couple of years where we couldn't really talk to anybody except for so that was a problem.
So, I like poking holes in things too. So please do not take this personally.
Do it.
So one of the things I would assume if I was a teacher applying to the to a new school, that if I see that this school is being built and it's a community connection, collaboration, I'm going to be really motivated to go there. And maybe there's lots of people who have applied and the administration selects the most motivated, engaged instructors to come and teach. Do you think that has happened? Do you think that that might impact the outcomes at all on how things are viewed?
That's a great question. I don't know that. We didn't ask where, we didn't ask anything about the job application process and the selection process. No, we asked how long they had been teaching and kind of where they came from, right? And that kind of thing. We did not ask anything about the selection process. And of course, there may be a selection issue right there, obviously. But I'm not sure how we get around that in the context that we have. We did find the one negative thing that I was surprised was a lot of the teachers were interested in joining the Y, but it wasn't as affordable as they thought it would be. They didn't necessarily get, I don't think they got a discount or any kind of incentive because they were on site. So that was a surprising kind of negative.
Yeah.
But again, that's not anything that the building or the site planning or the whatever did, right? But that was something that we found.
But there's an opportunity for negotiation to continue to build that collaboration, for sure.
Right. And there's plenty of opportunity. There's all kinds of community programs that are, constantly being developed and rolled out in that school. And it's pretty amazing.
So it looks like Nathan Williams has a question.
Yes. Hi.
What's up, y'all?
Hello.
Tracy, thanks so much for doing this. And yeah, I teach over in Parks and Recreation with your co-collaborator. And I'm convinced that one of his kids just like fired up Zoom. Oh, and he just dropped off. Where did he go?
You called him out.
I'm going to give him such a hard time.
Called him out.
Chatted something at him and he didn't even respond. So, but anyway, one thing, so I care about little kids, but I care a lot more about the big kids that we work with at NC State.
Yep.
And definitely one thing that's been on my mind through the student crises, especially this semester, is how drab and depressing and inconducive to collaborative work a lot of our classroom spaces are. And so you might be, I can't tell if you're sitting in one right now, right?
Oh, it's not pretty.
Yeah. But no, so one thing I'm curious about is I'm definitely interested in this work from like a design perspective and a broader management perspective, but are there things like as faculty who might be able to like request small amounts of money or suggest small changes to classrooms? Like, do you have a sense of like, what are some top heavy hitters when it comes to how do we create environments that are like supportive for mental health, supportive for learning, especially for like college students, if you can prognosticate a little bit?
So I don't know if I have any answers to any of that, but I can tell you that
that's it. I'm dropping off too. I'm out of here.
Yeah, right. Some of our PhD students are looking at those kinds of questions, right? One of our PhD students, actually two of them, are looking at design for inclusion. So at predominantly white institutions like us, how do some of our minority students start to feel engaged and ownership? And that's not really classroom design, right? Classroom design, if you're gonna try and impact, really all you can do if there's a little bit of money, it would be like furniture or something, or things on the wall, whiteboards, or something where you could, and I saw some of this in Tally the other day, right? Where there's like a cork board or something where you put something up and people can interact with it, right? Some kind of, I belong here, I've been here, I'm engaging here, or furniture. That's really probably at the scale I think you're talking, that's probably what you're going to get, right? Without involving facilities and big renovations and retrofits and things like that. I do know that they are, so Tally, obviously, particularly in the Witherspoon renovation that's going to start happening, right? They're really starting to focus on engagement and belonging and mental health and well-being and spaces for that kind of thing. But those are in student centers. Those are in gathering spaces. Those are in highlight spaces. They're not the classrooms that you're talking about. I did just this week do a stint over in natural resources for Environment 101 every afternoon. And I was in 3 spectacularly fairly different rooms. One was absolutely miserable. One was not bad. And so it was largely about, and it was actually kind of about like the furniture and the orientation. The orientation, you're not going to be able to change, right? The walls kind of look like mine here, like white concrete block, but that's fine. But the furniture was really kind of what helped, and daylight. But again, I don't know that you can be able to do that in your spaces or at the scale that you're talking about.
Mm-hmm. So are there best practices for like furniture selection and stuff like that, or is this field not really at that point yet?
No, I mean, I think it depends on what you need to do in the space, right? Because there's so many different types of furniture. You can have tables with roller chairs. You can have, I was in the room. It was kind of a larger room right behind the new renovated coffee. It might not be new to me, where the library used to be. There's the coffee space now. There's a,
yeah.
So it's got really nice, like red kind of rollery chairs, so they could just like roll around and get into their groups. And it was nicer than some of the other ones that would be more difficult to kind of do that. So I think it just kind of depends on what you need to do in the space. Like if it's a seminar space and you can have like really relaxed kind of loungy spaces, then, there's plenty of furniture over in Hunt. They've got like 45 different types of chairs, and I'm not kidding, over in Hunt Library. And so just go and like take an afternoon and sit in a bunch of chairs and see which one you think works best for the types of classes. But again, with as much as we switch classes, what might work for my seminar class might not work for your seminar class. And so it's just tricky.
No, thanks for that.
Yeah.
Can I ask another question? Am I allowed? We're a small crew, right?
It's up to Tracy.
Yeah, sure. Hey.
This is totally selfish, but I teach a class in facilities management for like parks and rec majors.
Yep.
And is your book like a source for folks who might be doing like could it be applied as like we're going into a facility to do a wellness assessment from a facilities management standpoint? Or is it like too construction industry oriented for that?
I don't think so. Do you use, so the class that I'm teaching right now for architecture is lead for operations and maintenance.
Oh, cool.
Right. So that might be a framework to look at. And we usually partner with facilities and Doug Morton and all the facilities folks. This semester we went off campus and we're doing Durham Public Schools for like the first time ever. We are usually right on campus. But it's much more about how the facility works and operates. And it's about energy consumption. It's about renovations and repairs. It's about all that kind of stuff. The book that I wrote with Margaret Van Bakkergem, who was one of your graduates. Yep, she was my co-author. The most recent book, which I don't even have a copy of to show you, it does kind of, it kind of gives you a larger kind of overview of here are the health considerations that we're talking about when we talk about health in design. Because it's for my practicing professionals who have been out there practicing architecture for 10 to 15 years and none of us have been trained to talk about health or be public health people, right? We don't know. And my husband practices and I can be like, hey, let's talk about health. And he's like, that's not a thing that I do, right? And so it's kind of this larger, here's some of here's what we're talking about. And here's how what you do matters, right? It's a very kind of overview basic of here's the concepts that we need to understand. So I don't know, some of it might.
Yeah, cool. Well, if it's okay, I might ask to see your syllabus from your ops.
Yeah, I'll totally send it to you.
Because I'm like new to teaching in that class, and we're doing experiential stuff. Like I took them to Beach Road Community Center. And I'm doing some like facilities improvement recommendations, but yeah, the level of like rigor or standards and best practice might be questionable. So I'll follow up with you.
So I'm going to send you certainly don't have to come, but we do a large workshop with the client at the end of the semester, like showing our findings.
Yeah.
And so it's on a Tuesday, like the 29th. I'm just going to send it to you and you don't have to come, but if you want to come and hang out and see, it's in Tally and we'll be presenting operations and maintenance findings. Very sexy stuff. Very exciting.
Well, I'm doing the same thing with them in Tele. Maybe, I don't know about that day, but maybe days after that. So
cool.
We might have parallel courses in a way.
That'd be awesome. Love it.
Well, thanks so much for doing this. I appreciate it.
Sure.
Well, Tracy, we're a little bit over time, but I wanted to see if anybody else had any questions. If not, I will definitely be asking you to come back and talk more about this. And I'd love to hear more about the work you're doing just in general. And maybe we can do like a co-interview with you and Aaron.
Yeah, seriously. He needs to be there. We have this funny picture of like the quantitative and the qualitative, and it's quite a meme.
Yeah.
It works.
Yeah. So I would love to have you back. But as we're wrapping up, I do want to say thank you to everyone who has joined us today, and especially thank you to you for sharing your research with us. And I want to remind everyone that we broadcast every third Friday of the month at 2 p.m. And our next show will include Dr. Michelle Schroeder-Moreno. She's the director of the Center for Environmental Farming Systems, or CEPS, and a professor in crop and soil sciences. And we'll be discussing her work on agroecology. You can find more information about the Wolfpack Wellness Research web series and our previous show recordings at Wolfpack Wellness at the Wolfpack Wellness website. And I'm your host, Susie Goodell. Until next time, be well.
Thanks, y'all.